What's the experience around the...
Among the challenges that county stakeholders attribute to MES project is human resource capital.
Most of the MES equipment are actually in use. But we've had a few challenges. We had delays in commissioning or operationalizing of most of those equipment because of human resource challenges. Like in Kajiado, we had the renal unit equipment being delivered about 2 years ago. We could only commission that this year, early this year, because we didn't have a renal nurse. We were placed under Moi Teaching Referral Hospital as a mentor hospital. And you know, Kajiado na Eldoret, ziko mbali sana. Yeah, but we managed to actually train our own nurse. Previously, before my current role, I was in the County Public Service Board, and I remember us, advertising for a renal nurse, and we didn't even get a single response, which means we actually had a shortage of renal nurses in Kenya. So we had to train our own, which took us about 1 year. We trained our physician and other medical officers to be able to manage that unit, so we could only commission it early this year.
There's someone who had a question here.
Further to this, there has been decry over an equal distribution of the machine, yet all the counties made an equal contribution of 200 million shillings.
There was a bit of unfair distribution of MES equipment. Most counties were paying the same amount of money, but you realize some counties actually received much more than others. We have counties that have received the same equipment as Kajiado, but they have an ICU, they have a CT scan here, they have, and there are counties that got very little of that equipment. So we feel as counties that there was not very fair distribution of the MES equipment.
If not, then it starts accruing what?
While the MES project is a blessing, it is feared to be a short-term project as the terms of engagement are not clear after the 7 years of usage are done.
We are also anxious about the terms of the contract. There is no clarity on the future terms. The way they were negotiated, including what happens at the end of the 7 years. Is it that they're going to take away the equipment? Are we going to have, another negotiation again? Are we going to buy the equipment? We don't know what really will happen. The other thing is that there are parts of the MOU that have not been implemented.
No, she isn't.
Health equipment maintenance is another key area that came up with experts arguing that they are not being properly taken care of, thus reducing their lifespan and efficiency.
And that is why now we are seeing our health is deteriorating every day. We are not addressing what is this that is being used to measure you, like a blood pressure machine. Has it been checked? Has it passed the quality? How frequent is it being maintained? Who is that person maintaining that machine? Is there a certification to indicate that an engineer or a technician has certified that this equipment has passed the calibration test? When was the last time the meter which is being used to calibrate that machine, when was it last calibrated? So those are the things that this contract has put in place. We have to indicate to them our calibration cycle, which company we use for doing calibration of that test instrument, and when is it done and who is doing it.
The actual difference is making the lives of people who are seeking health care.
The county government's representative during the forum went ahead to emphasize the importance of data sharing, further reaffirming their commitment to make the healthcare sector work for the benefit of Kenyans.
The sharing that has been done by our brother from yes. So you can see it is possible to share information and to improve on what is being done in the spirit of participation. So we We look forward as county governments to have a deeper engagement in terms of making sure that there is value addition brought by this equipment to healthcare delivery, that the intergovernmental relations are cemented for the good of Kenyans, and that there is efficiency in the manner in which we are using our investment in the health sector.
As the country throws all in the ring towards the attainment of universal health coverage, there is need for more public engagement and awareness so as to finally realize the dream with a system that works for all.
National Health Service will not go to